अभी हम कोविड की दूसरी वेव से बाहर निकले ही नहीं थे कि अब तीसरी वेव की बात शुरू हो गई है। ये तीसरी वेव संभावित कब आएगी, आएगी कि नहीं आएगी, इस पर आज हम डॉक्टर मोहम्मद सुल्तान खुरू से बात करेंगे। डॉक्टर खुरू ना केवल इंटरनेशनल रिप्यूट के डॉक्टर हैं, बल्कि ये खुद में ही एक इंस्टीट्यूशन है। डॉक्टर एम.एस. खुरू सर, वेलकम टू जेके न्यूज़ टुडे।
Adab Benuji, and thank you very much for calling me on this your show.
थैंक्स सर, माय प्लेजर। एंड ये शुरू करते सर हम कहें कि आपने पिछली बार हमारे इस प्रोग्राम में कहा था कि थर्ड वेव फैक्ट होगी या फिक्शन होगी, अभी देखना है। तो इस वक्त आप क्या देखते हैं सर? हाउ डू यू सी?
Third wave, we pray and we should attempt and also try that it becomes a fiction. It doesn't come. We have made a detailed assessment of the first wave of COVID, which came in 2020, जो उसमें आई. Then हमने assessment किया जो second wave आई, which was quite eventful all over the country as well as in J&K. So we gave a full assessment of that. What was the cause of the second wave? Now, जो second wave है, it is at its lowest ebb now. अभी तो we have started from J&K में, there were maximum 6,000 cases. Now they are, alhamdulillah, they are only about 120 or maybe around 100 cases per day, and the deaths have nearly disappeared. It's about maybe one or no deaths. So this is what ये नेचुरल फेनोमेना है वेव का कि वो ऊपर जाती है and then it comes at the lowest. When it comes at the lowest, that is the time we have to give an assessment. What are the chances that we'll have a third wave? So we have given a good view of that what are the conditions that a third wave could come, or what are the conditions that we could keep the third wave away. The first condition now is these waves are now driven by variants. I think everybody has to understand कि ये जो variant आगे wild type of virus के, wild type of virus is वो virus which has come from China, which went all over the world. Then that is called the wild type of virus. But now there have been, because of mutations, there have been number of variants. And Hindustan mein or Kashmir mein, we have seen at least two variants, the Alpha, which came from UK, and Delta, जो तो Indian ही है. So both of these variants were in J&K, both in Jammu as well as in Kashmir. Probably in the later part, जो Delta wave virus था that came or variant, it was much more prevalent in Kashmir than Jammu. पहले जम्मू में तो शुरू हुआ, but then it became more prevalent in Kashmir. We have traced it week to week. So that is the first thing. These variants can drive the third wave. Not only these variants, if we get a new type of variant, अभी तो Delta plus की बात कर रहे हैं, maybe there is some other variant which we don't know yet. That is number one. Second thing which will drive the third wave, a fact or a fiction, will be our vaccination program. अभी तो आप देख रहे हैं कि above 45, nearly in J&K, we have nearly covered the first dose above 45. And around, I suspect around 20-25% second dose. But that means there's a substantial amount of people yet who have not got the second dose. And between 18 to 45, it is not as good as above 45. 45 to first dose हमने पूरा cover किया. But important would be below 18 because they are not, vaccine is not yet recommended below 18. So that is the second thing. All these factors have to be taken. Third would be, whenever a wave comes, it usually does not come in the same population in which the first or second wave came. First wave came in elderly people who are comorbid disease. Second wave जो आई, that came in between younger people, middle-aged people who are healthy. So it's unlikely that these groups of people will get affected by a third wave. Now, then what are the populations which are susceptible? One population is the childhood population. उनमें भी vaccination हो नहीं रहा है, because this is not allowed yet. So that is a susceptible group. Second thing is pregnant women. Third thing is people, अभी तो mostly waves आए श्रीनगर और जम्मू में and congested areas, far-flung areas, or some special group of people who may have a special predilection for COVID. It may come in them. So we'll have to keep a watch on that. So that is the third part. And fourth would be very important. How do you and me behave? How does the public behave towards, because whenever the pandemic or the epidemic is the lowest, people get complacent. They say, "Wo to ho gaya, ab to case hai nahi." So they will not use masks, they don't use protection. And also the government, whether it will allow such meetings or such situations where there would be a super spreader phenomenon. We'll talk about that. What is the super spreader phenomena? So we have to be away from that. So if we understand these things and analyze them and do a day-to-day or week-to-week and month-to-month assessment, I feel the third wave would be a fiction. But if we falter anywhere, so we are there and the virus is there. It's a very cruel disease. It doesn't, it goes across anybody. So that is my feeling about third wave.
अभी जो कुछ हम मीडिया में देख रहे हैं एंड फॉलोइंग द रिपोर्ट्स फ्रॉम सम एक्सपर्ट्स अराउंड द कंट्री एंड इंटरनेशनली आल्सो, हम देख रहे हैं, लोग कह रहे हैं कि ये जो थर्ड वेव है वी आर एट द इनिशियल स्टेज. क्या हम इनिशियल स्टेज पे हैं थर्ड वेव के सर इस वक्त?
No, actually what happens in all these waves, if you see the curves, when a wave comes, there is a steep rise, then it reaches right at the peak, then it falls down, and then it forms a complete, a sag-like thing, if you say curve. We are at the lowest this time of the second wave. So we can say that the second wave has gone. Please understand, this second wave is not gone because of our efforts. This is the natural phenomena of the pandemic. That it comes in waves.
That's very important.
It is how it naturally works. So now is the third wave. Then if there is a situation we create that the virus can spread because of either variants or because of our super spreader phenomena or because we falter in vaccination or a population which is not vaccinated, then a third wave will come, and it comes usually in the next 6 months. It takes 6 months, and if we falter too much, it might come earlier, but if we are strict, it might come later. But if we really maintain ourselves disciplined, then it may not come. But generally, all over the countries, if you see UK and some other countries, even while the vaccination has, both doses have been very high, like UK, it is 52%. A third wave is there. Yeah. So please, we should not say and be complacent कि अब virus चला गया, अब है नहीं, अभी 100 cases हैं, there are 60 patients, there are no deaths, so let us go out without masks. Let's not use any measures to protect ourselves. So that is and very important is, while you are on that, very important is we have to understand how will this virus in the third wave spread. We probably need to discuss that. If at all a spread has to happen, how will it spread? Probably we'll discuss that in a moment.
सर एक चीज़ हमने देखी सेकेंड वेव में, कई लोगों ने ऐसा कहा कि RT-PCR टेस्ट में लोग जो नेगेटिव आ रहे थे, दे वर स्टिल पॉजिटिव इन कोविड, वो क्या कारण था?
But I'll tell you the problem with the tests. Each of the tests we use has a sensitivity and a specificity. Sensitivity means that if there are 100 people with COVID and you use a test, how many will be positive? In RT-PCR, about 70 to 75 people get positive. That means there yet would be a person will have COVID and you do an RT-PCR, about 20 to 25% will be negative. So that is one. But if you use a rat test, then it has a sensitivity depending upon whether if it's a sick person, around 60, 70% same. But the next part is the specificity. Specificity is that if you do not have COVID and you do a test, what will be the negative test? Usually both of these tests have a good specificity. That means they do not wrongly diagnose COVID, but they miss a substantial group of people who would have COVID, but they will be negative. This is itself RT-PCR, as this is the problem in the test. So once you do a test, it will not be necessarily positive for everybody. And that is why you will have some definite COVID patients. They might have lung disease, they might have all the symptoms of COVID, and you do an RT-PCR, it will be negative. And then the doctors are using alternative means to diagnose it, like they're using CT scans, they're using their own brain कि ये COVID जैसा लगता है और इसके घर में और बाकी COVID patient है तो इसको भी होगा. So we are using clinical medicine in that. The test is not necessarily to be positive in 100%.
सर रैट की एफिकेसी कितनी है?
I have, the day this test was put in India, I sat that night and worked up on that. RAT is a good test, but it's very dangerous. It is a good test if you use for people who have symptoms. That means if you use for people who have fever, who have sore throat, who have lung disease, RAT is a good test. It has a good sensitivity. But if you use it in people, general population, to do surveillance, it has a poor sensitivity. It can miss lots of people, about 50% people. So other than RT-PCR, RAT is good for people when you use it in the hospitals to diagnose people, but it is bad when you want to do a surveillance. That means you want to check their relatives or you want to go to the community. There it is, sensitivity is around 50%. So that is a problem with RAT, but it's very easy to use. You can get results in few minutes. And so if you suspect that somebody has COVID and you use a RAT test, it is negative. Best thing is to take an RT-PCR. So that is the recommendation by the ICMR and by the government of India, and we all follow that. That if RAT is negative, yet suspect that isko disease ho sakti hai, so use an RT-PCR.
सर आपकी ये जो रैट का थ्योरी लेके ना, सिंस आप गवर्नमेंट का कंसल्टेंट भी हैं यहाँ पे, हम लोग एंट्री पॉइंट्स पे देख रहे हैं काफ़ी भीड़ हो जाती है. जैसे लखनपुर का एग्जांपल ले लीजिए, लॉट्स ऑफ हंड्रेड्स ऑफ पीपल लाइंड अप टू गेट द रैट डन. हाउ वुड यू रेट दिस? इज दिस गुड इनफ मेजर? क्योंकि अगर किसी एक को भी डेल्टा पॉजिटिव होगा तो ही इज गोइंग टू स्प्रेड इट लाइक एनीथिंग.
It is good enough for one reason, that it is very easy to use and you get the test. It is a point of care test. हम उसको कहते हैं, in medical terminology, we call it point of care test. Point of care test is that you get the result while you take the sample. You take a sample, you put it in the rat, that slide, and in 2 minutes you get the test. You can say whether it is positive or negative. So for travelers, suppose somebody comes to Lakhanpur or comes to Srinagar airport or Jammu, if you use RT-PCR, by the time the RT-PCR will be positive or negative, will be 2 days or 1 day. So that man would be already in. So it is an advantage that it is a point of care test. But yes, it has an inherent problem that it will miss about 50% people. So you have to make a choice. I mean, the science is in front of you. You make a choice.
No, so my
It is
worry
a
is
good test from a point of view of, doing the test, but it is sensitivity is 50%, while RT-PCR is 70-80%.
so my worry is not the efficacy of rat. My worry is the crowding that takes place at Lakhanpur.
Now, there are issues which come up in vaccination centers. There are issues which come in while you are doing a rat test, many people. There are issues which come in the hospitals when you go to a physician. There are issues in the banks when you line up. Now, all these people, all these issues of crowding, even in vaccination centers, there are people who got COVID in vaccination centers because there's crowding. So you can spread COVID in these centers. The best thing is that those people who implement these policies, they have to be careful, like doctors in the clinics, like bank managers in the banks, like same RT-PCR testing or rat testing in Lakhanpur or Srinagar airport, and also even in vaccination centers. If you do, like if you saw today, they were showing that in one of the vaccination centers in the country, there was so much of overcrowding. So you will definitely spread COVID in those centers. So that is a problem that we have to be careful about. Crowds are not allowed, and it has to be disciplined. That's all.
Sir,
But yes, your problem is right, what you are saying.
the possible third wave, आप कौन सा वेरिएंट इसमें देखते हैं ज़्यादा होगा?
Now, it's very unlikely that the wild type of virus will give a third wave. It's most unlikely. The reason for that is it has already hit us first time. It has also hit partly second time. So it is very unlikely that, and many of the people have already got exposed to it. And whatever vaccine is used, it is effective against the wild type of virus. So that virus is very unlikely to cause, you might have cases because of wild type of virus, but it is not going to cause a pandemic or an epidemic. The second is that variant which transmits faster has an advantage to cause an epidemic. Now, the UK variant, what we call as the Alpha one, the Delta variant, which was called the double mutant variant, that goes much faster. Transmissibility is faster. Either one of can do that. But we already have been hit by those both in the second wave. Now, COVID, Delta plus, it has an advantage because it has one more mutation, Delta plus. So it transmits faster than even Delta because there is one more mutation in that. So it can do that. Or if we allow the virus to proliferate, like here or outside the country, you might have another variant, which we don't know yet. And once that comes, people are not exposed to that. So it could be either Alpha or Delta plus or a new variant, which could, if you are talking of the variants. Now, these variants, where from they will come in J&K? There are only two ways to come in J&K. If there are lots of infections, variants form. So abhi to infections bahut kam hai because the virus makes mistakes once you get a lot of infections. And if the infections are less, the virus cannot replicate. It doesn't make mistakes. We don't have variants. So it's unlikely that we'll have variants, native variants from J&K now because it's very low infection rate. But yes, the travel advisory is important. We can get variants from rest of the country or from rest of the world, like UK. Like if there's a country where like Africa, there's quite a bit of epidemics going on. Like UK now, the cases are coming up, and even some of the Southeast Asian countries, cases are coming up, and even in our country, South is not yet completely free of corona, and Northeast also is being hit. So we can get if we don't use a proper travel advisory, we may import these variants into J&K. And then once it comes, then obviously it's going to spread. It doesn't need to really by our own if we don't follow rules. So
डॉक्टर साहब,
travel advisory is very important.
जो आपने कहा once it comes, तो आप सीन क्या देखते हैं थर्ड वेव का यहाँ पर?
We have given a detailed report on that. We suspect it will either be a population which will be younger people, below 45, 18 to 45, number one. But unless their vaccination program and that group goes very fast, children will be another group, particularly between 2 years to 18 years. Now, pregnant women, I had suspected, I made a lot of noise about that because they have to, once a pregnant woman, she has lots of issues of immunity and she can easily catch infections. And she has to also go to the antenatal clinics too often. So, but now the vaccination for pregnant women has started, so there's a good news. Or it might come in distant areas, or it might come in some of the areas. It might spread if you have big gatherings like Amarnath. So now the government has already done very good. They did not allow Amarnath Yatra. Or like Eid, if you got big gatherings, the government has already used. See, these are very intelligent ways of stopping the third wave. The government has done very intelligently not allow gatherings. If you want to pray, pray in the mosques, the small gatherings. But if you go to Eidgah, you will have lakhs of people. So stop it. So they've stopped it. Like Amarnath also, do it symbolic. Or some other, whatever gatherings are there. So they could be either symbolic or they could be controlled. This is the major super spreader phenomena which you can prevent. This is called the major super spreader phenomena. Then there are second line super spreader phenomena which happen in small gatherings like marriages. Like किसी की death होगी, 100 people, 200 people join. In the earlier it would be lakhs of people. Here it is hundreds of people. But that also can cause a super spreader phenomena of a much lesser degree. Then the last part is inside the houses. You allow some relatives who are not vaccinated to enter your house, or you go without vaccination to somebody's house. 10, 15 people join. So that can also cause spread. So the super spreader phenomena at number one level, government has an important responsibility and they have done that. They have stopped Amarnath. They have stopped Eid gatherings. Second is now marriages and kisi ki death hogi, social function. That is within us. The government uses orders, but it's very difficult to control it. And then third is small gatherings in the houses. So if we control all these things, the super spreader will not spread in a way what is called super phenomena. And certainly the other thing is the travel advisory which you were mentioning.
डॉक्टर साहब, ये थर्ड वेव, इफ इट ऑल इट हैपेंस, इसके सिम्टम्स क्या होंगे इस बार?
Generally saying it will maintain its basic symptomatology, it will maintain. Because the virus is same, the virus attacks in the same way. It cannot change, even the variants, it can't change terribly. So the symptoms nearly 70-80% will be same. Because it's a variant, it has some different clinical manifestations. Like first wave, it was definitely throat and lung, and very few other organs. Now in the second wave, what we saw, that number of other organs are involved. A lot of patients with clots, heart disease, some people had brain involvement, clots in the vessels. So that became more common. Generally, it will maintain its 60-70% same symptomatology, but there may be new symptoms. We don't know what those, depends upon the virus, what organ it attacks. Suppose it attacks more intestines, you will have intestinal problems. Suppose it attacks more liver, you'll have liver problems. Suppose it attacks more heart, you'll have more heart problems. But 70-80% it will be involvement of the throat and lung. So it will be only, you cannot profess now what will be the total symptomatology, but yes, generally it will maintain its tempo with new organs involved. Depends upon what sort of mutation the virus has.
So finally, डेल्टा प्लस वेरिएंट पे क्या हमारी वैक्सीन इफेक्टिव है?
The issue of vaccines, any vaccine, whether it is an mRNA vaccines or that is the Pfizer and the 2 mRNA vaccines, or Johnson Johnson vaccine, which is single dose, or you're talking of the Covishield, which is here, or you are taking Covaxin, or you are taking the Russian or the Chinese vaccines. All of them have been developed on the wild type of virus. So there is no vaccine which has been done or yet worked up where a variant or a mutant has been used as for vaccine. So it is supposed to do whatever effectiveness in phase 3 trials are, it is supposed to do against the wild type of virus. But now we have different viruses. They will definitely not work as much as they work against the wild type virus. Now, how much it works has been worked up for many types of variants, like South African variant does not hardly works 20% against Covishield. That's why South Africa did not use Covishield. While it does work against Alpha and Delta, but certainly not to the same extent as it works for wild type. If it for wild type, it has 60-70% effectiveness, it may be about 10 or 20% less. And then this Delta plus, which has one more mutation, will certainly be less than that. So people have to appreciate that even if they are vaccinated, fully vaccinated, infections can yet occur by the wild type of virus, but less, but they can also occur by the variants. So they have to sort of take care. But yes, once the infection occurs, generally, it will not be as severe as you would have got without vaccination. And you generally do not need oxygen or, God forbid, die if you have vaccinated. Although there are instances, but it is very uncommon that a fully vaccinated person will go to the hospital and need oxygen or die. So, but infections can yet occur. And this person can also give infections to his family members or to anybody who he comes in contact. So this is the issue. Now you might say how to deal with it. We are already on it. We may have to change the vaccines. If a variant becomes a big problem, probably a third dose will be needed. And that will be done from that variant. Or maybe there is a vaccine where we use more than one variant to use the vaccine. But till now, all the vaccines have been made from the wild type of virus. So this is an important thing which people have to appreciate.
Thank you so much, Dr. Saab, for your such a valuable information and sparing such a lot of time. Thank you very much for joining once again.
Thank you very much for calling me, and I'm always at your back and call because this is a disease which we have to conquer. And I think one of the ways it will conquer is by people like you who tell the people what we should do and what we should do. Knowledge is very important, and getting the correct knowledge and all these things which are coming up in the community against vaccine and fake news, they should be probably sort of discouraged. And by your coming up and putting in this program, I think we will be able to help fight this pandemic. Thank you very much for calling.
Thank you, sir. Thank you so much. Thanks.